So, what does arthritis feel like? This is a question that we get all the time where clients come in saying, I have arthritis. I know my pain is coming from that. And then we ask some questions and we are starting to understand like, that's not arthritis. That's not how it feels. And so, we're going to learn about what arthritis, what it feels like, and when is it really arthritis and when is it not arthritis, and how does it respond when it's not arthritis. We're going to talk about that as well. And then we're also going to talk about why we are getting this diagnosis of arthritis and how this leads us down to the path of a lot of fear of like, there's nothing I can do. And this is just what happens as I get older. And I'm here to tell you it is not true. My name is Stephanie. I am the owner of Empower Physical Therapy, and we help chronic pain patients get rid of having to have surgery or being on medications or being on injections and really getting their life back. That's what we specialize in. And we're here to tell you that it is possible. Our bodies have this amazing ability to heal if we give it the right environment. So make sure you subscribe if this is something that you like, and definitely share this with people that need to hear this message. So let's talk about what arthritis really truly feels like. So arthritis is an inflammatory condition. So when you have something that is very arthritic, a lot of times you can't really do anything to make it better and worse. It's just really inflamed. And when you have patients that come in, we had one literally that came in this week, and they came in like, I know I have arthritis in my back. I know. And I'm starting to ask her questions like, well, tell me how it responds. And she says, well, I am really stiff in the morning. And I'm like, great. Okay. And then what happens? Well, I actually feel a little bit better as I move around. And I'm like, interesting. And when I'm hurting, if I go work out, I actually feel better than when I did by not doing anything. I'm like, that's not arthritis. Like, it's very mechanical. So when you can change your position and make it feel better and worse, that means that it's mechanical. You can do something that can make it better, and you can do something that can make it worse. And that's when you need to come in and find someone like us, someone that can specialize in really understanding where to get to the source of your pain and your problem, because you can make it better and worse. You feel better with movement. And when we feel better with movement, that is very mechanical. That means that we can help you get your life back. And so that's some of the frustrations with this, is that people have these misconceptions about arthritis and what it feels like. And, oh, my pain is this. And, the doctors tell me that, it's just what happens as I get older. And when I take this picture, that it shows that that's what I have. But in reality, most of the time when people come into the office, arthritis is not the pain. Like if you have pain in your joint, a lot of times it's the soft tissue around that joint that's creating some problems that we have to address. Or there may be problems in another area that's creating some of those issues. Or maybe there's some structures that aren't moving correctly that need to be moved that can get you better. So this is the good news is if you're noticing that you can move and it feels better, that's good news that you can get some resolution. Now, the reason why you get stiff if you have been in one position for a very long time. So like if you've been lying down at night, or you've been sitting for a long period of time, or not moving. So our joints love to move. And when there is some issues, when you sit or you're in one position, you're lying down, you're in one position for a long time, it's really common for any injury for you to feel stiff as you start to move initially. So think of like, even when you're younger and you had an ankle sprain and you haven't moved it in a while, and you get up, you start walking, you kind of limp. And then as you start getting warmed up, it starts feeling better. And then you don't limp as much anymore. I mean, very common, like it's just what happens, but we associate that with, oh, that's just what happens because I'm getting older. And when I get older, I get stiffer. Well, it doesn't have to be that way. You can definitely improve your mobility and that stiffness. You just have to get to someone to understand kind of what's going on. So if you have arthritis, the way it feels like, it's that constant aching, throbbing pain that you can't change your position to make it better or worse. So why do we get these diagnoses? We get these diagnoses because you go to and see a doctor and they're only able to spend 10 minutes with you. They don't have a lot of time with you. So when you come in, you're like, I'm not really sure what I did. I've been hurting for a while. It's just really stiff. And then they go in and they take a picture of it and they go, yeah, you see, the height of these discs, the space between your Your vertebrae is much smaller. That's really common as we get older. That's, degenerative changes, very similar to arthritic changes, or maybe you have some bony changes that are happening within the bones. And so the areas, have just gotten smaller because of some of those bony changes. They see all these things like, well, this is arthritis, or this is degenerative changes, and that's where your pain's coming from. But more than likely, it's not. If you can change your position and make it better and worse, that means it's very mechanical. It means that we can figure out something to get you feeling great again. But that's the reason why we get these diagnoses all the time, is because as we get older, we also show more on our imaging. So like, I know you hear me preach this all the time. You can take 100 people with no pain whatsoever. And as they get older, those 100 people will show something on their imaging. I mean, 60 to 90% of them will show something on the MRI. They're pain free, whether it's, a herniated disc in the back, whether it's degenerative changes, whether it's, stenosis, whether it's, any of these things, rotator cuffs, meniscal tears. These are things that are just normal wear and tear that happen as we get older. Like very similar to as we get older, we tend to, get wrinkles on our face. It's just a part of aging. Well, we get wrinkles on our bones too. And so just because you have those doesn't mean that that's where your pain's coming from. But when you have a 10-minute conversation with a doctor, then they're not going to be able to really understand, like, well, let's just see if what's on this image is really true, or ask you questions like, we ask you questions. We're spending 30 minutes with you just asking you questions in our evaluation to get an understanding of how the body responds, to start going, okay, we need to look at this area, this area, this area. So when we start moving you and understanding how your body responds, we can get down to figuring out the source. That does not happen in a 10-minute conversation or a 10-minute evaluation. And so that's why we get a lot of diagnosis of arthritis and degenerative changes that happen with our back. But I'm here to tell you, the majority of the time, they are totally fixable if you get to someone that understands what's going on, because there's several pieces that you have to understand. You have to understand, where's the source coming from? You can have issues in your lower thoracic spine that can give you pain into your lower back. You can have lower back issues, things that aren't moving. You can also have issues within your hip that also is created. You can have combinations of all these things. But, when you go see a doctor and they'll tell you, oh, well, I only can look at the back. Well, I have hip pain too. Well, you're going to have to come back for another appointment. Like, this literally happens to our patients. So you make another appointment for the hip and you make an appointment for the back, and you're only looking at those things, and you don't understand, like, they don't understand that it's connected, like they are connected. So these are problems with our healthcare system that leads us down the frustration of having more procedures, more injections, more surgeries that don't lead us to a positive outcome. Because if you don't understand where the source is coming from and what's going on, and you decide to have a surgery, guess what? You're going to go down those same patterns of everything that you did to create some of these issues, and they're going to come back again. And so it's really important that you get to someone that understands how to navigate all of this. So what are some things that you can do? If you notice that you feel better with moving, then I want you to move. Go out for a walk. Your back's going to love it. So make sure that when you walk, that you're not bent forward at all, that you are in a good posture positioning, and go for a walk. The body starts moving. When you move your hips and they're walking side to side, that actually feels really good to the lower back. And if you notice that that's the case, just keep on walking. Movement, keep on moving. It's going to make you feel better. So if you're feeling a little stiff and you're wanting to do those things, start walking and noticing some changes. And if you're noticing changes, wow, this feels really good, and you really want to get to someone that understands what's going on, give us a call, send us a message. You can reach out to us on our website, www.m as in Mary, power-pt.com, empower-pt.com. And we have a lot of links on there, a lot of education. You can click on the link that says talk to a physical therapist, and we can set up a time to have a conversation, learn a little bit more about what's going on and how we might be able to help you. So make sure you do that. Also, I have a book that's out. And we're getting rave reviews on it. People are loving it. And that's on Amazon. And that is Inspiring Hope. That's the title of it. the secret guide to hitting pain from all angles to get you back to living life. There's some great chapters in there on your back, on your hip, and even on the thoracic spine so that you can learn how everything is connected. So you can find that on Amazon. We're here to be a resource for you. Again, if this is information that you love, make sure you subscribe, share this with someone that needs to hear this message so that we can spread the hope that there is something that you actually can do.